A beautiful morning to you. It's Jasiri o'clock and we're ready to give you the best 1 hour of talk anywhere. You can take that to the bank. Now today we're kicking off looking at something that is still often whispered about, misunderstood, and too frequently ignored. That's depression. We have a special report lined up that looks beyond the statistics to the human cost, the silence, and the gaps in care that many Nigerians still struggle to navigate when it comes to mental health. From there, we turn to another issue where silence can be just as dangerous: patients' rights and medical negligence. When people seek care, they expect safety, dignity, and accountability. But recent stories have once again raised difficult questions about what happens when the system fails and whether patients truly know and can enforce their rights. We're connecting these conversations because health is not just about treatment, it's about trust, responsibility, and the value we place on human life. This is Jasiri.
But first, we'll always hold space on this platform for mental health issues, and that's why, while many shy away from this topic, we embrace conversations around it. Depression doesn't always look like tears or sadness. Sometimes it looks like showing up every day, smiling, working, or parenting while falling apart on the inside. Mental health experts say thousands of Nigerians are battling depression in silence, not because treatment is unavailable, but because stigma prevents many from seeking help. In a society where mental illness is often misunderstood, sufferers are left to cope alone. But depression is real. It affects young people, parents, professionals, students, and yes, even those who seem strong. Therefore, News Central's Emmanuel Olubobokun takes a look into mental health in Nigeria.
Behind closed doors, many Nigerians are fighting invisible battles. Battles they are afraid to name and too ashamed to share. For people living with depression, simple daily routines can feel overwhelming. Yet, instead of empathy, many face judgment.
I think for me, I didn't even know early enough, right, that I was experiencing those things. It's funny that even though you are in that space, you may not readily know that that's what you're experiencing. I began losing interest in things. I couldn't sleep. My mind was occupied. My brain was foggy, and and all of those things. And I was just completely had a breakdown even in my relationship with people. Until I reached out to a friend and I was like, bro, I don't know what's happening to me. And then I began to tell him, I was like, bro, that seems like depression, but you've got to talk to someone, and now that I reached out to a psychologist, and I reached out to, did my assessment, my diagnosis, and they required for me to speak to a psychiatrist because I needed medication. So if I had known early enough what it was, I definitely wouldn't have even gone to the point of needing medication.
Mental health professionals say stigma remains one of the biggest barriers to treatment, pushing people further into isolation.
Depression is a disorder of mood. Mood is often described as an individual's subjective feeling. So most times when you ask someone, oh, how are you feeling? Or like, I'm fine, or I'm not so great. That's mood. That's how they reflect mood. But depression is a mood disorder in which there are what we call the core symptoms and then the additional symptoms. Now, what are the core symptoms? The symptoms of energy, mood, and interest, all low. Sometimes some people who are depressed or who struggle with depression may find that they have self-harm thoughts. They have thoughts of harming themselves. And they may also, a red flag that we often look out for is the fact that they may decide to take their own lives.
Experts warn that until stigma is confronted, many Nigerians will continue to suffer in silence, choosing secrecy over support and survival over healing.
There's something important about looking out for each other. We're humans and we're social beings, and so it's important to look out for each other. Look out for people who are the strong ones, the ones who never complain, the ones who appear to always be there for everybody else. Look out for the ones who have had recent significant life events. They've lost a job, they've lost a partner, they've been diagnosed with an illness. Look out for them. And so instead of just waiting and hoping, hope is good, get help. Ask for help, because help is available. And help is not only just medication. Some people will need medication. Some people just need professional talk therapy. And some people need social support. Some people need financial support. But if you keep quiet, you won't get the help.
Nigeria's mental health advocates say awareness must move beyond conversations to policy, funding, and community education. For those living with depression, being seen and heard could be the first step towards recovery. In Lagos, Emmanuel Olubobogun, News Central.
You know, it's like an equity.
And that was an interesting package there. We have never been shy here on Jasiri to talk about mental health issues. We've talked about mental health in pregnancy and after pregnancy. We've talked about men and mental health specifically. We've talked about women and mental health. We've talked about mental health in general. And it's a conversation we can't get tired of. Unfortunately, with Nigeria, given the high poverty rates, the high unemployment rates, the economic issues, the struggle that people are facing each and every single day. It's not to say that those things cause it, but they can make it easier for people to find themselves in mental health situations. And then, you know, another thing I keep stressing this, we have an alcohol abuse problem. We focus on the fact that Nigeria has a drug abuse problem. Yes, we don't shy away from that. But alcohol abuse. Alcohol is a drug. It is a drug. And a lot of people are using alcohol in this country to dull themselves, to just get through the night, get through the day. We have to confront even our alcohol consumption as it is, and also what part that might play in mental health issues.
And I think that we need to be there for each other a little more, because sometimes all these challenges that is mental, all you need is a safe space. And I find out that we women seems to gravitate towards safe spaces that helps us to cope. So men, especially in this time, at least in 2026, you know that we have talked relentlessly about it, that you need to find your own circle.
Your community,
a community that can help you, that you can feel comfortable in, to be able to share. Because if you can do that, you see that the help that you need, you might be able to find it from your circle. I know how many times we've talked among ourselves and we have solved the issue. Remember what I was having issues about the boys and we talked about it and you said do this, and
some people don't have that.
The thing was done. So we need to be more vigilant about the people that we love and people that live around us. Like when you see people's status. This morning I was asking Beauty, I said, are you okay mentally? I know you're not feeling well. Do you need time to rest? You know something? Because I'll see her post things like, thank God I have my last 2K. And I know you don't have last 2K. I know you're okay. But if we're not looking and probing and asking questions, there might be people around you. Check their statuses. Sometimes the status of people on WhatsApp tells you what they're going through.
You know, I was complaining to you guys yesterday. I posted yesterday that when it rains, it pours.
Immediately you came.
And so Lola attacked me, not attacked me. She asked as soon as I had like 6 people. My friend was calling me from Ibadan. She called me like 3 times when I was driving. I didn't know that was what the issue was. She said, please just let me know you. And I was just, because fridge has gone kaput. Washing machine has gone kaput. Car says it needs overhauling. I was just like, I was just a lot on a Tuesday morning to just wake up and say the fridge is not working.
So you can imagine that for some people, that can trigger a series of, it has a ripple effect. We sit on this table and sometimes in the makeup room and sort of therapeutize everything ourselves. We listen to each other. Which day did I say, oh, my pumping machine, oh my God, what are you doing pumping machine? But that's the reality. So you see, when things happen like Tolu's now, back to back to back, you ask yourself, what is the problem? What am I missing? What am I not doing? Let me share something with you guys. So I was in a meeting yesterday, and it was a work meeting, and suddenly we conversation moved to mental health, and there's this woman who just gave birth, and she has postpartum depression, and she cannot, for the life of her, do anything, concentrate on anything. And then there's another who after 4 months, you know, she says her libido hasn't come back. She's struggling with a lot of things. So guys, this is real. And I don't know what triggered that. It was something that triggered something. Before you know it, everyone was sharing something. And they left that meeting becoming better. So we must always put ourselves, just put a pin on what we are doing, pause, and listen to people. I have a friend who, when she calls, you know that It's not
She needs
a
to unburden.
20-minute call. This is a 1-hour call.
Yeah.
So I mentally prepare because you have to, for her to call you, that means you've given her the safe space to call and share and talk. Because sometimes, like the doctor said, sometimes you just need to talk through. It's not
Talk therapy.
anything heavy,
Yeah.
but the truth is that we are going through a lot. People are going through, and it's not even in Nigeria, outside, globally.
Everywhere.
Globally, the world is
And
hard.
now we're also worried about Trump dragging us into World War III. So you just feel like there's
I
a
thought it was
general...
just me.
No, it's not just you. You feel like there's a general sentiment, a general air of uncertainty, anxiety. So there are people who have stopped watching news. If it was not for the work that I do, I would not watch news. I would disassociate. What is the work that I do? Because it's heavy.
It's heavy.
Front pages of Nigerian newspapers today, right now, they're talking about insecurity. FG wants to fast track the trial of 5,000 insurgents. We're hearing about the suicide bombing yesterday that hit a military convoy. You want to just go back and Makoko is still on the front pages.
Yeah.
You're seeing the number of people who have died in that situation. We're talking about the, I think, is it Kaduna church attacks?
Yeah.
It's just
The guy that killed six
bad
people.
news. The guy that killed
Fresh
6
in
people.
our mind.
So you are inundated. If you're not careful, almost buried in it. And really, we all have to find our ways to give ourselves and find. There's a lady I follow on social media, and she calls it pockets of joy. Yeah. Find those moments in our days that you hold on to. That if it's a YouTube channel that anytime you watch makes you laugh. Use it. If it's following somebody that makes you happy,
animated
do it.
series story.
Yes, listening to what this word. If it's coloring, I have coloring books in my. When it gets to my head, I will put my laptop aside, bring out my coloring book, and I will.
I saw Chigirl does jigsaw puzzles. She built like castles. I found it so fascinating.
Find that thing. And I don't think Nigerians recognize hobbies.
Yes.
We recognize hustle. We're looking at everything to make us money. It must serve a purpose. Sometimes the purpose is just simply to relax you, to make you happy.
And air your mind.
Air
if
your
you
mind.
Understand what that
so
means.
sometimes it's just that. And because we are a country and a people that are constantly hustling. That hustle culture, it puts a lot of pressure on us. And we understand why. Because unfortunately for many of us, one salary is not going far enough. It's not even taking you home. It doesn't even get you on the bus.
Yes.
So we understand why. But in the midst of that, we need to find space for ourselves. We are all going through some things. And I remember once when I was doing Rise to Wisdom on Nigerian radio.
So was so good at that.
We talked about something.
She used to encourage people every day.
And I was not awake at 5 a.m. But I remember, and it's not to say that people's problems are minute, but I remember something. We said if everybody puts their problems on the table, many of us would quickly snatch our problems back when we see the burden, the load, the issues that other people are dealing with. It's not to say anybody's problem is bigger or smaller. It's a situation, but when you see what is truly happening behind the scenes, for many people, you would be like, you'll square up. You'll square up.
Honestly,
it's a lot.
Anyway, it's quite a lot. But as we always tell you, here on the table, we're not afraid, to talk about things that are very important. When we or our loved ones seek medical care, we do so at our most vulnerable, trusting doctors, nurses, and hospitals to do no harm. But recent cases of medical negligence have raised difficult questions about accountability, safety, and patients' bill of rights in Nigeria. So after the break, we'll be taking a closer look at the patient's bill of rights and what it guarantees and where it may fall short and how Nigerians can protect themselves when seeking care. We have Dr. Folari Olashogba, Chairman NMA Lagos State Committee on Private Hospital Affairs. He will be joining us after the break to get on this very important conversation. Stay with us.
It was in July 2018 that then Vice President Yemi Osinbajo launched the Patients' Bill of Rights with critical stakeholders like the Consumer Protection Council, the Nigerian Medical Association, the Ministry of Health, and others present. The Patients' Bill of Rights is an aggregation of patients' rights that exist in other instruments, including the 1999 Constitution, the Consumer Protection Act, the Child Rights Act, the Freedom of Information Act, the National Health Act, and other regulations. Almost a decade down the line, many Nigerians are unaware that they have rights, when it comes to how they engage with medical personnel in Nigeria. Today, we're looking at these rights in light of recent heartbreaking stories that have put this issue in the spotlight. A baby lost and an anguished family questioning the standard of care, a woman who underwent surgery only to be left with a foreign object inside her body that led to her death. These are not just headlines. They are reminders of deep and sometimes persistent gaps in how health services are delivered, regulated, and monitored in Nigeria. The Patient's Bill of Rights was designed to ensure that every person seeking medical care in Nigeria is treated with respect, dignity, timely information, consent, confidentiality, and fair treatment. But how can you demand rights if you don't even know you have them? Joining us now is Dr. Folarin Olasogba. He's the chairman at Nigeria Medical Association, Lagos State Committee on Private Hospital Affairs. Dr. Olasogba, welcome to Jasiri.
Thank you very much.
Thank you.
For having me.
Yeah. All right, so let's get into the meaty matter. I know for many Nigerians, this may be the first time they're hearing about, Patient's Bill of Rights. Some may not even have been aware that there's something called, when I was in the baby making business, I had no idea that there was Patient's Bill of Rights. Now we have it up for awareness and education and discussion. So let's start from there. In practical terms, what does the Patient's Bill of Rights do? And what core areas does it cover for patients?
Okay, thank you very much for bringing this up at this time. The Patient Bill of Rights, like the word bill, is an aggregation of several other rights that exist in some of the instruments that exist before now, right from the United Nations Universal Declaration of Human Rights. It draws strength from there. Then, at the professional level, there's World Medical Association Declaration of Lisbon that also covers some of doctors' responsibilities or physicians' responsibilities to their patients. And I think that also contains about 12 elements, just like the Patient Bill of Rights. Then down to the Nigerian Constitution, where fundamental human rights, freedom of speech, and all of that. And then you come to the National Health Act. Some of these rights are already there. The Medical and Dental Practitioner Act that established the Medical and Dental Council, the Medical and Dental Practitioner Tribunal, and all the disciplinary committee. Just to say that these are rights that have been existing for ages, and these are, at the professional levels, are known to doctors. What the Nigeria or Federal Competition and Consumer Protection Act or Commission did was to pull all of these rights together into one document and call it Patient Bill of Rights.
Okay.
And now, when these rights were advertised, or rather launched, I think it was promoted in a way that made it look like, oh, it's a patient against doctors or providers kind of thing. It's not. It's not supposed to be. It spells out what the patient must do, what rights they have, the duty of the providers, and then there must be some alignment. So it becomes one kind of partnership that must exist between patients and doctors. By selling it in a way that gives patients the impression that, oh, they are going to the hospital to tell the doctor what they know about their rights, creates some sort of, and that is not good for healthcare delivery, healthcare services. We must push it in a way that patients will understand that healthcare delivery, healthcare services have to be some kind of partnership and not adversarial. It has to be such that your right to access safe, medical, responsible medical care, right to information, right to transparent billing, right to decline treatment when you think, regardless of what the doctor thinks, you have the right to decline. But it's also subject to the fact that all of these things, you have a role to play you must also disclose the rightful information to the doctor. When you have right to emergencies, I mean, you have right to emergency care, regardless of the condition, you also must realize that you have a responsibility, you have a duty to pay and show commitment that you'll be able to pay. So this thing has to be presented in a way that patients understand that it's not going to help any of the parties if the patient bill of rights is presented in a way that makes it look like it's anti-doctor, it's antagonistic, and all of that. Yes.
You know, Dr. Flary, I'm looking at, I would have asked you a question, but you seem to have answered about that, because we already talked about what it's meant to change between patients and providers. You know, I'm looking at some of these rights, which are clear and simple, clearly worded and simple. But I see that in Nigeria, it seems that we don't follow through with some of the things that we write down. And I want you to expatiate on that a little. Like right to information. I have consulted with doctors, and sometimes they are vague about what is being told to you as a patient. Maybe I go and I want to know more about what is happening, you know. They go through, you know, some corners, and I'm like, okay, why can't you just tell it to the patient as it is? Because you have a right to information. That is what is going to determine the kind of care you want to be given. So that's why we're looking about access to medical records. How are these medical records kept in the first place? Because these days, with the advent of technology, I am still a bit worried that we are still very manual, analog about medical patient's record. I will go to a hospital or a general hospital, they will still go and search your file for some time. And you're like, when are we going to, you know, overcome some of these challenges when it comes to this bill? Like right to consent. A lot of times, you know this thing that you just said now, a lot of Nigerians don't know that you have a right to say, I refuse this care. How do we even help patients to know? Because if they don't know, they cannot call on a right to privacy and confidentiality. I have seen some unpalatable circumstances where patient information are just either by maybe incompetent staff, you know, some of those bridges. How do we bridge them? Let me not even go about right of dignity and care. Oh no, that I don't want to.
Beside you can tell you about it now.
I don't want to talk about that. I have gone to hospitals that I've had to ask the nurses that this is a human being. Why can't you just cover the person? Say, you know these patients, they don't know what's wrong with them. When she's ready to put herself together, she will. And she's in labor, she's throwing her dress apart. But they have this right. So doctor, when you said it's not like we have to attack you, doctor.
That is a partnership.
It's a partnership. But when we see that some of these rights are clearly being flouted day in, day out, what is the recourse for a patient in Nigeria?
Again, you know, let me start from where you started. Giving patient information. I think it's part of the responsibility, it's part of our professional training that patients must be adequately educated, must be informed. You must, as much as possible, ensure that the patient understands what you're saying. And sometimes you have to ask questions for the patient to repeat what you have said to be sure that
they understand.
He clearly understands. But you know, we are different. When you are passing information to patients, you try as much as possible to come to their level. And you have to deal with different kinds of patients. Some of them have their mindsets on what they want and how they want it. You as a professional, I remember back then when I was in my formative years as a medical doctor, I saw a patient who was not compliant with our medication, an hypertensive patient. And I had to sit down because part of the training is that for hypertension, it is not enough for you to give drug. You must educate.
Yes.
Because giving drugs may amount to nothing if the patient doesn't understand why he must take those medications. And I did my best, my very best to educate her on why she must take medication, why hypertension is treatable, you can live your normal life, and then if you don't do all of these things, there are possible complications that might arise from stroke, kidney, all of that, and then death. In my mind, I was doing my best to educate. And the woman left, only to come back the next day, and then came with her husband and pointed at me like, telling the husband that this is the man that said I would die.
Is that what you said?
I was like, I was shocked. And in my mind, I felt like I did my best to educate this woman. And I sat the husband down, please, who am I to say she would die? I'm not God now. And I repeated everything I told her. And then the man was a bit relaxed. Now, going forward, I felt perhaps I gave too much information that was not necessary. Okay. You know, and you now begin to manage the information you give because
based on the patient in front of you.
So sometimes you need to ask, and that patient bill of rights also indicates. That's why I said that when we are saying patient rights, patient responsibilities must also go side by side. You may need to ask the doctor specifically, because the doctor is looking at how much does she understand, how will she interpret if I say exactly this, you know. People interpret, process information differently, and you want to, as much as possible, deliver the information exactly what you want the patient to know, not more, not the one that will add to a problem. Now, you know, we're not saying that the system is perfect. We know that we have a shortage of human resources, infrastructural deficit. These are things that are not only peculiar to the healthcare sector, it's a universal problem in Nigeria. So where you find some of those instances, we also need to interrogate. I know that so many things happened in the past, but I also know that as far as physicians are concerned, they are very mindful because we have a regulatory body that is very strict with ethical issues, with professional issues. Now, when you get to a facility where you have one doctor seeing several patients.
We know the ratio of these things.
Yes, so you also need to also put that into consideration. The doctor is human. There is a limit to how much he can do per time.
True.
You know, so if you find those circumstances, look at the environment, look at, is this man already overwhelmed? If he's overwhelmed,
engagement gets shorter, it gets tighter, it gets more difficult.
So these are some of the variations, and that's why even when they say standard of care, it is relative, because you have to look at what is available before you can expect to find, you know, a Western style kind of treatment where doctors have a maximum number of patients they must see within a day.
But even that's, well, we'll get into that because we will talk about the Medical and Dental Council of Nigeria and how patients can make complaints or lay complaints if they want. But we're going to take a quick break now. When we come back, we keep saying that we think Nigerians don't know too much about the Patient Bill of Rights. Well, when we come back, Jasiri on the streets, we'll find out just how much they know. Stay with us.
Welcome back to Jasiri. Before we go further, like Tolu said before the break, we hit the streets to see what Nigerians know or understand about the Patient's Bill of Rights. Let's just hear what they had to say.
I feel most of the hospitals we have or we've seen, probably they are not abiding to the laws, because I believe for every profession there should be a law that is going to guide every profession. I guess maybe some of them are not just guiding, they are not going through the laws given to them.
I have had bad experiences in some hospitals when I was serving, you know, going to an hospital and, you know, the nurse is just being aggressive, but I feel it's work pressure or something. Some are just unusually aggressive. There's this attitude they give, but I feel they need to work on it. Most hospitals need to work on that.
Our general hospitals are Most times, in terms of emergency, they are supposed to attend to the patient and also ask them what exactly happened and treat them according to what they have explained. But they just feel like, oh, they should get first aid, or they should get injection for this, only based on what they have seen.
Maybe because it was a government hospital or something, they delayed me for a while and they did not respond on time. They were saucy somehow.
So many persons who have been to the hospital and they are neglected. They are being ignored. It can lead to death. You understand? When they are not treated, when they were supposed to be attended to. Even some of them that are emergency, they are neglected at the hospital. I can say the Nigerian system is not being fair.
The slogan or logo, whatever, is health is wealth. At least if the person is still alive, for you to even give a treat or do something, you can even admit the person. If they didn't see any money to pay, you can still admit them that they are already putting themselves in other people's shoes. I think they will have that consciousness, like, no, if this was me, I wouldn't want them to be treated like this. They should be conscious. They should have conscience.
Most hospitals, they are not swift. Yes, so they should be swift. Just treat our patients with love. They should treat us with love and more extra care.
They should pay attentively to their complaints. When they hear a case of emergency, I feel like intensive care, they should be given intensive care as soon as possible or as fast as they can to save more lives.
I feel like they should know better in how to treat people and how to dealing with people generally. A patient should report. They should report when they are not treated fairly. They should air their view. They should report so that the system can actually work.
Welcome back to Jasiri. Dr. Olashogba, I know that you heard everything they say. Were you surprised by their responses? Because you see that many of them almost said similar things in different ways.
Experiences,
their own experience. Do you think that there may be maybe a cultural or systemic barrier that have historically made it difficult to guarantee that these rights in Nigeria, it works? That our health facilities conform to the rights and the laws that are guiding them.
All right, thank you once again. So I must say that we understand that there are systemic gaps. It's not, the health care delivery system in Nigeria is not where it ought to be. It can be much better. It's a work in progress, if I must say. But that is not to say that we would completely indict the entire system. I'm sure there are so many hospitals right now where patients are receiving compassionate care, where they are getting healing, where they are giving their doctors and hospital thumbs up for a good job, for a work
well done.
Well done. Yeah. So, I mean, it's a mix of, of course, for all the gaps, we'll continue to work to improve on them. But we also must continue to acknowledge the good works that doctors and physicians are doing out there in Nigeria, like squeezing water out of the rock. The truth is, I know recently there has been things like reverse medical tourism. People are coming all the way to Nigeria to receive care for so many reasons. And we have seen hospitals from all over coming to set up in Nigeria. That is something positive, something we should celebrate, because if it's not right, they won't be coming back. If patients are not getting results, they will not be coming back. But then that is not to say that it is perfect. It is not yet uhuru. We need to improve on what we have. And the feedbacks are very important for us to continue to improve the system. There is no system all over the world that is perfect.
We agree.
I must say that.
Nah.
Just these things, doctor, I hear you. We see these things with nurses. Everybody's first primary bone of contention is with the nurses. More than one person there, from the respondent, said they were unusually aggressive. like, see, you're not the only one with it. But you see that aggression. It's not...
Aggression, dismissive sometimes.
Dismissive, yeah. Rude even.
And so the question that was leading to my question, I was waiting for him to land, is as much as we're now trying to educate Nigerians that they have rights and that it's a partnership between them and the medical personnel that serve them, and you're saying that doctors are, are nurses being trained on bedside manner? Are nurses being trained on the rights that Nigerians have as patients? Are nurses being trained? Is the complaint and the feedback getting to the nursing regulators? And they're working on educating nurses about customer service, because they too are serving customers as patients. I'm putting him in a difficult spot.
Yeah, it is actually, because I honestly can't speak
directly to
to the nurses. I know that there are professional bodies and regulatory bodies that is also taking care of some of these things. I also know that we have some fantastic nurses out there that are doing a lot of job that some of us who also appreciate. Interestingly, they are the first point of call when it comes to patient care, and they get to see the patient first.
And even last, doctors will leave you and say, oh, the nurse will see you with your prescription, and follow up. Yes.
So they stay more with the patient than perhaps the doctor. They are the one that will be on the ward with the patient all through while the doctors are conducting their... So that might constitute a challenge, but then we know, like I said, is an ongoing process. We have to continue to improve. I've also had experience when my wife delivered in the US. I had similar experience where,
don't be
my wife
nice.
had to compare. Had to complain about some treatment she got, maybe from the nurses. I was not on ground to assess, but then just to say that
it's not just us. It's not just
Doctor,
us.
this one that we're even talking, let's not digress, because the bone of contention has been what has been happening recently. Because we have to talk about these things. Everybody that didn't even know anything about medical care, we have been hearing things about this medical negligence. Medical negligence, two different words. That means it's happening medically and it's negligent. Recently, there's an ongoing investigation into allegations of negligence in the death of a very popular author, Chimamanda Adichie. I'm sure you heard about it. Her son just, died this year, and it wasn't really pleasant at all. There is also the recent death of an Aisha Umar in Kano State, who died after surgical scissors were allegedly left inside her body. This was past alleged. This is, we can see it visibly during an operation. And we still had, recently we took a feature of a doctor, of a lawyer whose wife died after childbirth. In fact, he complained that his wife fell off the stretcher. The gurney, because there was no straps to hold her in. So even as much as we're educating ourselves about rights as patients, we also have to touch on these very important aspects because of all the conversations that we're talking about today. And I know that you are capable to be able to help us answer. What happens when there is medical negligence?
Maybe my deepest condolence to Chimamanda Adichie for the loss of her son, 21 months, I understand. And I know how painful it can be. Apart from just being a doctor, we're also human. And more importantly, we're parents. And so we understand how painful it can be when you lose your loved ones, and no words. So sometimes, no words can actually cure that pain. So having said that, to say medical negligence, is rather simplistic. Medical practice is a science. It is evidence-based. It is also probabilistic. And in fact, why it is evidence-based, it is also dependent on human biology, which many times are unpredictable. So it becomes a lot difficult to sit down here and pronounce negligent when I'm not privy to the case.
Yes.
I have not looked at the circumstance. Adverse medical outcome does not automatically translate to negligence.
Yes.
So we need to carefully examine and allow the process to run through. We have a regulatory body, like rightly said, that are already interrogating the situation. There's clinical review, the regulatory body are investigating.
Please, when they say they are investigating, because I'm a lawyer by training, I want to know what's the
process? How do they go through this investigation?
Is it that all the access to medical records? Are there recordings, autopsies? You know, because abroad now I see that even in surgical rooms there are video cameras that I see senior doctors reviewing a patient's surgery procedure. That was how they found out that the doctor was having drug issues.
The one I even saw recently is that the tray of medical implements is weighted. Yeah. So as you're finishing the surgery, different people have to sign off. And if it doesn't weigh what it's supposed to weigh, an alarm goes off.
Yeah. I mean, those are
advancements we're not privy to yet.
When we say regulatory bodies investigating, you're going to have specialists from all subspecialties of medicine set up by the regulatory body, MDCN, to look at each and every step of the way.
That was taken.
And be sure that where there are gaps, they're able to point it out. So it's not going to be somebody just sitting somewhere. They are going to look at the document, and I'm sure that the center in question is one of the
top notch
in Nigeria.
So
notable.
I'm sure there will be so much available to take a decision that will be transparent and that will be just and fair to all parties concerned. But, you know, the easiest thing for the public to say is medical negligence at the slightest provocation. And for me, as a professional, it would be unethical, unprofessional to begin to draw conclusions from media, social media comments.
So let me move you forward on that, because we don't even have the full details of the case. But what are the most common forms, based on the experience you've had, that are separate of these two cases? Again, to be very specific, separate of these two cases we've mentioned, what are the most common forms of medical negligence in Nigeria?
You know, when they say medical negligence, usually
adverse outcomes.
Adverse, yes, adverse. No, so,
that's
you know, before we can,
is death.
Adverse outcomes does not mean the medical negligence.
Yes, you know, we can agree to that.
People can, I mean, people die everywhere, all over the world, even in the best of hands, with the best facilities. You know, it can happen. That's why doctors will say we treat, God heals. You know, you can do your best, cover all the gaps, ensure everything, and the patient will still end up dying, unfortunately. But it doesn't mean that you are negligent in what you have done. But when you say confirmed cases of medical negligence, usually associated with surgical procedure, you do not have them commonly amongst the physicians or medical, but mostly for surgical procedures. And in fact, I'm sure you have heard of cases going to court, but it's only the Medical and Dental Council
that can determine,
that can say this particular case is a case of medical negligence or malpractice. You know,
how about that woman that was
reaching that standard of declaring something or a situation or a doctor or a hospital to be medically negligent or to be involved in medical malpractice is very difficult.
Yeah, like that case of this woman that we saw the scissors inside, sir. So, what would you say that is?
They're still investigating. They've suspended 3 people.
Yes, I've heard that people have been suspended. That is to say that there's something wrong.
There.
Who did what? Because, you know, it's a multidisciplinary approach, especially when you get to the theater. The surgeon has his role, the anesthetist has his role, the assistant nurse, you know, all of those, they have roles, they have things they must do, you know. So the doctor might just be concerned about, oh, let me take care of this pathology or the whatever you're trying to remove. I'm trying to avoid some technical words, you know. And then you, that you're supposed to handle instruments. Your own is just to continue to count the instruments and make sure that it's complete.
What goes
at
in
the end
is the same thing that comes out. Yeah.
So, you know, somebody must have missed out something if, you know, and that again will be decided. And I'm sure that those that are looking into it are more than experienced enough to be able to determine what went wrong and where.
So so we had a comment come in on WhatsApp, and it says, good morning. My wife died, he's already saying, due to criminal negligence by doctors. Placenta was retained after she delivered a dead baby. 6 hours later, the doctors did nothing to remove the placenta, even when they knew about it, because it was protruding, and she eventually died. I'm still in shock. How can this happen? I need help. So we can agree that adverse medical outcomes do not necessarily mean medical negligence, and that there's a standard, there's a high standard that has to be met. But even now, what we need to do is be able to educate Nigerians onto how to lay the complaint. So for someone like this, what is the next step? What's the process? How does he get in touch with the Medical and Dental Council of Nigeria and lay a complaint like this? We have the lawyer who's had a press conference, the MBA is behind him asking for it. But what about everyday Nigerians who want to lay complaints about either the medical service or care they received, or they believe that something went wrong and somebody is responsible somewhere?
I mean, there are a lot of avenues, including the Nigerian Medical Association. People have written to us when they suspect negligence or malpractice, and we have taken up cases. We have brought them to the table. You know, the Nigerian Medical Association is for professionalism and not for any kind of criminality, you know. So as much as possible, while we want the patients to be heard, we also don't want doctors to be wrongly indicted, you know. So, but when you have cases like this, you can write to the Nigerian Medical Association. You can write to you can write directly to them. The contact is out there in the public. Nigerian Medical and Dental Council. You have the Federal Competition and Consumer Protection Commission to write to. These are avenues through which you can vent your concern, and it will be looked into, and then decisions will be reached. And I must confess that one of the places that doctors don't want cases to go to, more than any court, is the Medical and Dental Council.
Dental Council, wow.
They don't want cases to get there.
Worst case scenario that can happen when a hospital is found guilty, or people, what's the worst case scenario?
There have been doctors that have been sentenced to
they lose their licenses, and then the criminal charges are put.
I mean,
have hospitals been
like
closed based on any negligent case?
Yes. So, you know, closing hospitals many times doesn't solve any problem.
True.
You know, the doctor is just one person, for instance, there. The hospital is an institution. Just like you will not close a bank, or you will close a general hospital because you think something is wrong with a doctor, you know. There are so many things involved. Yes, so closing hospital should be completely out of it, except if the life of that hospital is dependent on that practitioner only. You know. Otherwise, is a business entity, is a service provider, and is servicing not only that community. In fact, there are a lot of other healthcare professionals their source of livelihood is tied to that. So closing a facility, in my view, should not even be, and I'm not sure there's anywhere, except when it becomes something out of the ordinary, anywhere in the world, where the first thing to do is to close the facility. Take up the matter. There are so many avenues where you can vent those concerns, and it will be looked into transparently, and then you have justice to be served.
All right, Dr. Olashogba, we'll have to end on that note, but I think it is a conversation that will continue. And I think hopefully we have been able to help you unpack the Patient's Bill of Rights and also further conversations on the medical partnership. I like it that he emphasized that it is a partnership. Our health is a partnership with those who are the medical professionals in our lives. Now, today's conversation reminds us that healthcare is not just about medicines and procedures. It's about dignity, respect, accountability, and trust. To everyone watching us, know your rights, ask questions, demand clarity, and remember that no one should be afraid to speak up when care falls short. But remember, it is a partnership. Thank you for joining us on Jasiri. We'll be back tomorrow. It's Friday, which means it's hot topic. We'll see you guys. Somebody's daddy had to go and do press conference for him. We'll talk about it tomorrow.